MLT Case Studies Series 12. A case on the topic. Deciphering Hemolytic Anemia, a case study on hereditary spherocytosis. Unraveling red cell osmotic fragility for diagnostic insight. Introduction. The red cell osmotic fragility test is a diagnostic assay used to evaluate the robustness and stability of red blood cells, RBCs, in varying concentrations of saline solutions. It primarily helps in diagnosing conditions that affect the shape and resilience of RBCs, such as hereditary spherocytosis, thalassemia, and other hemolytic anemias. This test measures the resistance of erythrocytes to hemolysis when exposed to hypotonic solutions. Understanding the test. The principle behind the test is straightforward. Red blood cells have an optimal osmotic environment in isotonic saline, 0.9% NaCl. When RBCs are placed in hypotonic solutions, with lower concentrations of NaCl, water rushes into the cells due to osmosis, causing them to swell and eventually lyse, burst. The fragility of the cell is determined by the concentration of the saline solution at which the cells begin to lyse. Normal RBCs have a standard range of osmotic fragility, while cells affected by certain disorders may lyse at higher concentrations of saline, indicating increased fragility. Sample case study. Patient history. A 25-year-old male presents to the clinic with symptoms of fatigue, jaundice, and an episode of dark urine. His family history reveals that his father had a splenectomy due to a diagnosis of hereditary spherocytosis. Laboratory tests. CBC, complete blood count, shows mild anemia. Peripheral smear examination indicates the presence of spherocytes. Based on the clinical suspicion of hereditary spherocytosis, a red cell osmotic fragility test is ordered. Red cell osmotic fragility test procedure. Sample preparation. Blood is drawn from the patient into an EDTA-containing tube to prevent clotting. Saline solutions. A series of saline solutions with decreasing concentrations, ranging from 0.9% to 0.1%, are prepared. Incubation. The patient's RBCs are incubated in each saline solution. Assessment. After a specified incubation period, the degree of hemolysis in each solution is measured. This is often done spectrophotometrically by assessing the hemoglobin released in the supernatant. Results interpretation. Normal RBCs typically begin to lyse at 0.45% saline concentration and completely lyse at 0.3%. Increased osmotic fragility. The patient's RBCs begin to lyse at a higher concentration than normal, e.g., starting to lyse significantly at 0.65%, indicating increased fragility. This result is consistent with hereditary spherocytosis. Diagnosis. Based on the patient's symptoms, family history, and increased osmotic fragility of RBCs, a diagnosis of hereditary spherocytosis is made. Treatment and management. Folic acid supplementation, to support erythropoiesis. Splenectomy, considered in severe cases, to reduce hemolysis. Patient education, on the importance of regular follow-up and monitoring for hemolytic episodes. Conclusion. The red cell osmotic fragility test serves as a crucial tool in diagnosing hemolytic anemias, particularly hereditary spherocytosis. Understanding the procedure, interpreting results accurately, and integrating clinical findings are essential steps for medical laboratory technologists in aiding the diagnosis and management of patients with suspected hemolytic disorders. Please subscribe for more content. Thank you. Vamsi.